Welcome to the Life of Excellence podcast, a podcast dedicated to the ever-evolving understanding of what it means to be human. We'll delve into fields of longevity, health optimization, neuroscience, explorations of consciousness, and meaning in life. Thanks for joining me on this ride, and let's get on with the show. So in this episode today, I want to talk about a question I get asked quite a bit from patients, and it's, is AI going to replace you soon? And it's kind of a complicated answer. AI certainly is one of my go-to tools in working with patients, and it's getting better and better at what it does. But I've found that the AI tools are really only as good as the kind of prompts that you can give this. And really, doctors should be learning how to interact with AI. If you're not using AI in your medical practice, you are shortchanging your clients, I have to say, because AI has been such a valuable tool in working with my patients and clients, and it's really made a huge difference there. And so I wanted to take some time today and talk about what we're seeing in the literature about AI and how I use AI daily in my practice. In fact, probably 40% of my day in the care of my patients is using AI and different forms of it for different reasons. But it truly is related to how well you can prompt the AI. And some people can actually do this at home to double check on things, especially when the doctors give them guidance. You can double check that, check back with your doctor, say, is that the best approach, or how about this? So the literature, they've done several studies in comparing AI to doctors, mostly in the realms of radiology, in the realms of pathology, mostly in these procedures that require skill sets of looking at different things. But they've also done it on interacting with a client on an intake, or a patient doing an intake for them, and the questions that it asks the patient. Interestingly, the one study I saw, the AI doctor was found to be more empathetic than the doctor, and doctors aren't well trained in bedside manner. That's well known. And so that's probably something that the AI could help them with for sure. Now, in the fields of radiology, there's been several studies, and they're varied, because some studies show that the radiologists are better, some show that the AI is better. One thing they did show is that when a radiologist utilizes an AI, they can be either really superior or really inferior to AI alone. And that came down to the skill set of the radiologist. For basic chest x-rays, for mammography, there was one study that showed the AI had a 99.1% sensitivity, so meaning it would pick up an abnormality if it existed, compared to 72.3% for the radiologist alone. And that was not surprising, honestly. I mean, AI can analyze, pixel by pixel, everything that it looks at. So it is going to probably have a greater sensitivity, but it may also overdiagnose. So it does take a skilled radiologist to work with the AI in that situation. And I think that's what we're finding is that it is still essential to have skilled clinicians that are working with the AIs. And how do we train these clinicians to work with the AIs? In pathology, reviewing pathology slides, it was also shown that the AI assisted reading of those pathology slides was much higher sensitivity than those of the pathologist alone. So we know that AI is now an integral part of medicine. There, there is no reason not to use this, but you've got to use it in the right way. So I wanted to talk a little bit about how I use it in my everyday practice. So in my everyday practice, I use various different AIs. I spend probably $200 a month in all of the AI subscriptions that I have, and it's been the greatest assistant. I can tell you that it saves me so much time on a daily basis, especially with paperwork. And let's talk about that one first. So there's all of these new medical scribe softwares, and you just have them listen to the conversation. And I do a lot of telehealth. I do in person and occasionally do phone calls. And all I have to do is hit a little button either on my phone, on my computer, and it will pick up the conversation. This program called Nabla. Uh, there are many of them out there. Nabla was one I adopted fairly early, and I absolutely love it. It was something that reduced my time commitment to paperwork by about 80%. And that gave me more hours in the day to do actual patient care and planning rather than doing the paperwork piece of it. So it records the entire conversation, and then it will create a complete visit note out of that. It doesn't matter if it's most of my calls are like 40, 45 minutes, and it gets them accurate. And one thing that I've noticed with that is that I would miss things in calls because I would be sitting taking notes during the calls. So I would remember things, and I missed so many little pearls that were coming up in the conversation that the AI was picking up. And I was like, oh, yeah, they did talk about this. And that was a game changer in and of itself. The cool thing with Nabla is that if I'm reading through the summary and I see, oh, they didn't hit on this point, it must not have thought it was relevant. So I'll say, expand on this topic that was discussed, and it'll pick it back up out of the transcription, and it will give me the the details of that piece of the conversation. So I was just so impressed with this, and it is just I basically copy and paste it, do one or two edits in it at most, and it's done. I mean, after I get off a call with a patient, I have the note completed within about 2 to 3 minutes in the chart and shared with them. So it's incredible. It even has what prescriptions I told them I would prescribe them, and the plan for the next appointment, et cetera. It even gives diagnosis codes, so I don't have to look anything up. So that's one of the biggest game changers that I adopted early on. And then you can use different things like ChatGPT or Claude. I like both of those for different reasons. They are not HIPAA compliant, so what I have to do is just ask it questions pertaining to a topic or certain laboratory values and have it do searches based on that. But it's amazing how well it works because I can like, one of the things that's really cool is I can take Claude, the newest version of Claude, and it has this thing called projects. So I can query all of these things about all these different tests that were done with a client. And I can have them all in the project, and I can say, okay, based on all of this information, are there any patterns that you're seeing? Is there anything that this might be suggesting? And it's been amazing at how well it's been able to give me insights into some patterns that I might not have been picking up. And it has increased the quality of care for my patients dramatically. Two other ones that I really like that help me with research is Consensus AI and Perplexity Pro. Both of these are very research oriented. So Consensus AI, you will ask the AI a question of, what's the best treatment for X currently, and it will gather the top 10 studies, and it ranks these studies based on, was it a randomized controlled trial? How many citations does it have? What's the reputation of the journal? Was it peer reviewed? And it ranks these in the top 10 research studies of recent years, and it will give you a consensus of what these studies suggest. And so you can get really up to date on any treatments that, I mean, let's face it, the amount of medical knowledge that is out there. I mean, I think it doubles every 72 days right now. I mean, doubling of the world's medical knowledge every 72 days. There's no way for us to keep up with that, but AI can. And AI can pull from all of that information and give us the consensus of it. So Perplexity AI is one that will give me a deep dive into research. So it will take, some of the most leading edge research and give me answers to the questions that I'm asking. But the one thing that I have found with these is I have to ask the right questions with them, whether it's Consensus AI or Perplexity. So Perplexity will go down certain roads that I'm just like, okay, no, that's not what I was asking here. How about this? And then it'll give me an answer, and I'll feel like the answer isn't quite right. So I'll ask it clarifying questions. Well, what about this? And I've even asked it, I've said, you didn't include this in the output that you just recorded, and it'll say, "Oh, my apologies. Here's the information on this." So this is where the clinician skill set is really required, and the ability to understand how to prompt the AI to get the details that you want. And that's why I think it's not ready for prime time to be an AI alone in areas, especially where there's complex interactions, very straightforward things. I mean, AI can diagnose Alzheimer's early with 98% accuracy just based on recording voice patterns in a patient. I mean, that's incredible. If you enjoyed the show, be sure to check out Appear on Elementals. Appear on Elementals is really my supplement brand. I formulate for this, and I formulate items that I'm looking for to add to my longevity protocol, my performance protocol. That's where this arises. And so these are the supplements that I take, and these are the ones that I recommend for most people. Check out Appear on Elementals today. It can diagnose COVID with, I think, 94% accuracy based on a recording of the cough. So you can see how AI has been such a valuable tool for me. I can research a topic like an autoimmune condition or the outcomes of a single lab, And it can suggest additional labs based on my questioning of saying, well, what would add to the evidence that this were the case? And it will give me the list of the tests, some of them that I had not heard of. I mean, I don't have a deep knowledge in like rheumatology or into orthopedics necessarily. So I can actually get the current information. It's like I'm consulting with certain experts. And again, it doesn't replace the orthopedic surgeon or the rheumatologist. It's really just giving me all of the indications of here are all the testings I can do, here are all the possibilities before I come to the conclusion that I need to refer this person to a specialist. And then when it comes to care plans, it's amazing. I mean, people will ask me for a diet plan, and this is amazing because I can put in the desired amount of calories. I can put in the percentages of proteins, fats, and carbs, and the types of fats, and then I can put in their food preferences and the foods that they generally avoid. And I can say, well, they eat generally 2 meals a day. Um, this is the timing on their meals. Give me a plan that will assist them with some fat loss over the next 2 months. And it will give me a daily plan of the foods, the amount of the foods, the calories, and the protein, fat, and carbohydrate distribution for that menu. I mean, I can even say things like, "Give me a ketogenic Mediterranean diet that fits these criteria," and it gives me this beautiful, menu plan and a whole calorie plan for the entire month. And the one thing you wanna do with this, though, make sure you put in that, the foods that they prefer and foods that they will not eat. And you can modify it if you read through it and something's there that says, "Oh, no, that's a food that they said absolutely no." You can just say, "Modify this with removing this food," and all of a sudden, it's got you a whole new month-long, 30 days of meals, at the, 2 meal a day that they wanted, at the calorie rate, at the carbs, fat, and protein levels, that you put in. I mean, it's amazing. You can do the same thing with exercise plans. This patient wants to build X, and what is an exercise plan that's going to give them the highest probability of increasing their endurance for running a 5K, and it'll give me the plan. I mean, it's just it's invaluable in that regard. Also, when you can add in some personal information, not enough to account for identity of the patient, but say, the it's a 54-year-old Hispanic um, patient that wants to do X. It can actually take aspects of that personalization, knowing certain genetic propensities for different ethnicities, and it can give you a better outline. It's just like for high blood pressure, there is a different approach to a African American versus a Caucasian versus Hispanic. You can put in this information, and it will fine tune the recommendations or the suggestions that it gives that then you can verify. And that's important. The doctors need to verify that the information is correct because AI can still hallucinate, and um, it's not quite completely corrected yet. They're not even sure exactly what is happening with the hallucinations, but I always like fact check, and I will ask it to fact check itself, and it will actually tell us when it's actually hallucinating. It'll say, "I didn't really find this study. I apologize. It was a hallucination." and then it would go on to give me a more well-researched answer. So back to the original question, am I afraid that AI is going to replace it? No, I'm excited that AI is here, and it has made me so much of a better doctor. I mean, the paperwork was killing me. It was taking up so much of my time during the day, and now I have full attention that I can um, put to my patients and actually spend quality time listening to them and hearing what they have to say rather than worrying about missing something while I'm taking notes during the conversation. So I'm very thrilled about AI and uh, its future potential. So thanks for listening to the podcast. I'm excited about sharing this information with everyone. Please hit subscribe if you're interested in future shows and leave a comment, give us a review, let us know what you think.